It's difficult to tell you how psoriatic arthritis typically presents because it's a disease which can present in so many ways. It can present with joint pain or joint tenderness, sometimes joint swelling. It can present in the small joints of the hands and feet or in a large joint such as the knee. It can present with spinal pain, or it can present with a difficult to treat tendon problem. Think, for example, the tennis elbow or an Achilles tendon problem or the patella tendonitis.
Often the first thing people will notice is that sense of stiffness on waking up in the morning, but sometimes they'll also notice some swelling of the joints, particularly if it's the larger joints like the knees or ankles.
Psoriatic arthritis, you can get problems with their back, but it's less common. About 20% of people, so 20 in 100 people will get some back issues, but very commonly the joints that are affected with psoriatic arthritis again tend to be the big joints like knees, but also patients will tend to get problems with their fingers. So big sausage-like digits. Very common in psoriatic arthritis. Sometimes patients will have psoriasis before they get arthritis, and other times, less commonly, you get the arthritis and then the psoriasis. You can also have psoriatic arthritis without having psoriasis at all, but can be quite a strong family history of psoriasis. And so the doctors, when you go and see them, will ask you very closely about your history.
He said, well, do you ever get any flaking or itching on your elbows, your head, or anywhere on your body? I said, well, as a matter of fact, I do. But I've got cousins that really get it bad. And I'd never thought of it much because it was just like a mild flaking, didn't really bother me.
Psoriatic arthritis may sometimes be a bit masked because we're focusing on the psoriasis itself perhaps. So we need to be able to get patients to come in early with any joint signs, stiffness, pain, swelling, and any family history of psoriasis in a patient's profile needs to be sought out. So a patient needs to come and let us know if there's any family history, what their skin condition is like, and we need to know about what's been affecting and concerning them with their joints and their skin. Any joint tenderness, any stiffness and pain with their joints in someone who has a background history or a family background history of psoriasis, that would make us be more aware that perhaps we need to be looking for psoriatic arthritis in these patients.